folks. Why Would You Ask That is a podcast that answers some of the weirdest questions. A lot of those are inappropriate for some listeners. If you're squeamish, easily disturbed, or just having a bad day, this may not be for you. But if you've got to know the answers like we do, stay tuned.
Why Would You Ask That? Presented by me, M, they, them, and
Karen, she, her, and
Remy, he, him.
And today we wonder, why the fuck is blood donation so fucking homophobic?
and biphobic.
Every phobic.
Just phobic.
What the fuck?
Only straight people can give blood? Like, what the hell? Gay people have very good blood.
And lesbians.
Yeah, straight people and lesbians can give blood.
I have bad news, everybody. It's gay to have blood.
Okay. So the American Red Cross estimates blood donations to be at 44,000 people per day. To put it into context, how many people give blood every day? The FDA establishes the criteria that we use to determine who is allowed to give blood and not give blood, so that we know that it's not the Red Cross's fault necessarily. It's largely the FDA's fault.
Oh, the FDA is spying on you, bro.
So, 1, cannot donate immediately after visiting a country with high rates of disease. And if you are a gay male or a man who has sex with a man, then you're banned for life. Those are the criteria that the FDA uses, or at least they did use until extremely recently.
Wait. Like, when did they change that? Because I was very, very sure that you could still do it, but you have to be, like, abstinent and shit like that, dumb stuff.
Well, you still have to be abstinent, but not for life.
Yeah, I thought it was, like, 3 months or some shit.
It is now 3 months, but up until just a few years back, it was for life.
Fucking God.
Yeah, like, okay, so why do you... But what if you have a, like, life partner and you are both monogamous and you don't have sex with other men?
Doesn't matter.
Doesn't matter. Fuck
Why?
you. Because you're getting laid, and gay blood is bad blood because AIDS and stuff. And every gay person has AIDS if they use their body parts for pleasure, apparently.
I mean, that's sound logic, I guess.
It's fucked up.
Agreed.
Basically, so let me start out by just reading the policy verbatim so that we can just establish the baseline. Here's where we're currently at. The FDA guidance says on the American Red Cross website, defer for 3 months from the most recent sexual contact, a man who has had sex with another man during the past 3 months. All U.S. blood collection organizations must follow this federal requirement. The Red Cross recognizes the hurt this policy has caused to many in the LGBTQ plus community. The first sentences were a quote, and then the Red Cross comes in and says, the Red Cross recognizes the hurt this policy has caused to many in the LGBTQ plus community and believes blood donation eligibility should not be determined by methods that are based upon sexual orientation. We are committed to working with partners toward achieving this goal. We continue to assist in evaluating alternative donor eligibility criteria and the expanded use of new technologies to work toward elimination of donor eligibility questions based on sexual orientation that would no longer be necessary. However, as a regulated organization, we cannot unilaterally enact changes concerning the MSM deferral policy, MSN, men having sex with men. So that's where they're at. Red Cross has no authority to change that policy. It's entirely the FDA that makes that decision. So that's where we're at right now.
So it's not them.
It's not them. It's the FDA that makes that rule. So the Red Cross, the last time that I checked this website, by the way, was like 2 years ago, before I started researching this question. So 2 years ago, that chunk wasn't even on there. It was just the chunk about how you couldn't have sex. So it's nice that they've added that, for one.
Yeah.
But to answer your question about whether or not that applies to men who are in monogamous relationships, that's answered on the website in the facts section where it says, no, the FDA guideline states, quote, defer for 3 months from the most recent sexual contact, a man who has had sex with another man during the past 3 months. It just says that that still applies to monogamous relationships.
That's so fucked up.
And so used to be, even if you were a man who was in a monogamous relationship with another man, like you would be banned for life, even though you were in a monogamous relationship and you both like tested for HIV AIDS and you were both negative and you were in that monogamous lifelong partnership with that one single person, you would still be banned for life.
That's like, I don't understand. Like, if there's nothing wrong with their blood, if there's no trace of HIV, what's the problem?
Being gay.
So to get up to the answer to the question, what's the problem? I'm going to start with the history because that's what I always do. So to talk about that discrimination with the FDA's policy and the American Red Cross's blood donation system, then we're going to talk about HIV and AIDS. In 1981, the United States reported its first cases of AIDS. The earliest cases reported it as, quote, gay-related immune disease, or GRID. And that established the initial homophobic stigma that has just never gone away. So though the studies have since shown that HIV AIDS is more prevalent among certain demographics, and notably these demographics are not just to gay men, young gay men and bisexual men do have a higher proportion, like a higher chance of getting it, but also disproportionately Black and Latino men are affected also, and also certain age groups are affected, but it's not by any means just a, quote, gay disease. Just to lay out some quick statistics before we sort of dive into the meat of this particular problem from the HIV.gov website. The statistics come from 2019, which is the most recent statistics gathered. So the rate of new HIV infections dropped by 8% from 2015 to 2019, which is great.
Yeah.
The highest rates of diagnosis for HIV are among these groups. The highest rates are in the South, which, just a sidebar, in case you're not aware, the United States government classifies these states as the South. Delaware and Maryland, because I didn't classify those states as the South.
Fuck no.
They're part of the South, according to the United States government. Delaware and Maryland classify as part of the South for the purposes of this discussion. West Virginia, Tennessee, Kentucky, North Carolina, South Carolina, Florida, Georgia, Alabama, Mississippi, Arkansas, Louisiana, Oklahoma, and Texas. Those are the states that we're talking about.
Most of those track.
All of them but two?
Yeah. I mean, well, Maryland technically counts because Maryland, the formation of Maryland is the Mason-Dixon line.
Still, I just wouldn't have.
Yeah.
I just wouldn't have. It's so far.
It feels far, but like, all of the South people were in Maryland too, so.
Anyway, I just wanted to include the fact that those are the states that are included in the discussion of the South. So the highest rates are in the South among the ages of 25 to 34, among the Black and African American population, with the second highest population being in the Latino population, and with the rate of infection being 5 times higher in people who are assigned male at birth. And then men who have sex with men, it's assigned as MSM in all of the official documentation, so I'll just shorten it down to that because it includes a large breadth of people, gay men and bisexual men and straight men who occasionally, like homoflexible men, I guess, heteroflexible men, whatever.
Pansexuals, my peoples.
Yeah. Just a whole bunch of different categories of men who have sex with men. So it's all shortened down into that category, MSM, in the official documentation. So that group of people, amongst all of those other groups of people, where the percentage of diagnosis is higher, make up 69% of people, which is a significant portion.
Nice. Sorry.
I wondered if you were going to do that since this is so serious.
I mean,
We need to do it.
69.
We need to do it because it is serious.
Yes. Our people would be upset
and
if we
then
didn't do it. That's what I'll tell myself.
almost the entire rest of the percentage is made up of heterosexual men.
Wow. Wait. So, sorry. So, 69% is like anybody who has sex with a man. And then the rest of it is heterosexual men?
69% is men who sleep with other
Uh-huh.
men. And then 23% is heterosexual men. So men who do not sleep with other men.
Okay.
Men who only sleep with women.
Who only sleep. That 23% is high.
Especially considering that the narrative says that only men who sleep with other men should get it, or people who use drugs.
Yeah.
But intravenous drug users only make up a very small portion of people who get HIV/AIDS. Actually, it was about 7% of the overall numbers here amongst all these people who get it the highest.
And really, I mean, what it comes down to is that there was just bad sex education, I feel like.
Seems like any men who have any kind of sex should probably stay away from stuff.
Any man who has any kind of sex should actually just be having safe sex.
Yes.
Is really the gist of this entire discussion at the end of it. But I haven't even had the discussion yet. But yeah, that's the gist of it.
Yeah. Safe sex, kids.
Anybody who has any sex should have safe sex, but men are more susceptible to HIV/AIDS, and they should absolutely be trying to have safer sex.
Mm-hmm.
So in 1981, 5 previously healthy gay men in Los Angeles contracted a rare lung infection, and then hundreds of cases spread across the nation. And by the end of the year, 318 people had died.
Whoa.
And so they called that acquired immunodeficiency syndrome, and that's AIDS. 85% of them were gay and bisexual men.
Yeah.
After 2 years of just bafflement, scientists finally pinpointed the disease to be bloodborne and also sexually transmitted. And so that led the FDA to set rules of refusal against gay and bisexual men and intravenous drug users. So donation centers implemented questionnaires that routinely asked potential donors about their sexuality and substance use. In late 1983, scientists isolated the virus behind AIDS, and within 2 years, blood banks were all applying the first HIV test, which is called enzyme-linked immunosorbent assay, to all the samples that they collected, and the analysis successfully detected HIV antibodies 96 to 98% of the time.
Wow.
They pair that with something called the Western blot test, and those two tests together detect HIV almost perfectly, except for there's one problem with the two of them. There's still like a window period, they call it, of like 6 to 8 weeks right after infection where the virus was not detectable by these tests. So that window period is what the FDA used to justify banning gay men from donating blood, because they were scared because they couldn't detect it. And so really, for the time, for 1983, it made some sort of sense because they didn't understand.
Yeah. Yeah. I mean, when it's at its height, like, and you just aren't sure, like, it does make sense because you don't want to get other people sick. It's like if people giving blood now, like with COVID, we just weren't sure if it was a good idea, even though it needed to happen. It was, it's still not safe. I mean, it is safe now because we know how to identify it, and our technology is a lot different and can detect things a lot faster, and they've learned how. But back at that time, I understand the fear.
Yeah. Back in that time, it was a lot different. But yeah, now we have much better methods of detection. And so we have like broken down that window period to 7 to 14 days. And even the 4th generation HIV test, which was introduced in 2010, detects both antibodies and antigens, which develop even faster in the immune system. So we can detect these things way faster than 6 to 8 weeks now.
That's awesome.
Yeah, it is awesome. So In 1982 and 83, the U.S. started identifying HIV/AIDS in heterosexual patients who were largely intravenous drug users, hemophiliacs, and women who had sex with men. The damage to the queer community had sort of already been done. HIV/AIDS decimated queer communities all over the country. Basically, I saw somebody on Facebook talking about AIDS recently and said that we should remember that during the 80s, the queer community basically lost almost that entire generation and then had to start over with a whole new, basically first generation in the 90s.
Yeah.
So, like, millennial queer people are essentially having to start over from the ground up with a lot of things.
Look, bro, don't make me cry so early in the night. It's not cry time yet. It's only just a little past 8. I don't schedule my crying till after 10 o'clock. I'm not ready for that.
Well, I'm sorry. You buckle up.
Oh no.
So, and it's I feel like that's a pretty valid statement to say that the queer community lost so many people and took like major back steps from where it was before, as far as like the rights that they were trying to accrue as a community and like where the general public acceptance level sort of was by the mid 80s, which wasn't spectacular but also wasn't as bad as it was on the other side of AIDS.
Mm-hmm. Oof.
And then we all had to start over again
Mm.
in plenty of aspects. And so this was a relevant point to mention right there. So in the spring of 1983, in an emergency effort to stop the spread of the disease, the FDA issued this lifetime ban on blood and plasma donations from, quote, persons who might be at increased risk of transmitting AIDS, particularly gay and bisexual men, referred to as an MSM, who had had sex with another man since 1977, they said.
Jeez.
As a temporary emergency measure, the restrictions were really harsh and discriminatory, but they made sense, we just said. It limited the chances of spreading the disease because they didn't know anything about it. It was widely considered a death sentence. They didn't understand, they couldn't treat it, but it was supposed to be a temporary measure, and it wasn't. It was not temporary.
Mm.
HIV is largely treatable in some capacity. We know a lot about it. We know it's not exclusively linked to MSM. It can be detected by testing any donated blood before it can be used in transfusions. The early epidemic-induced panic has worn off in a lot of aspects, but the stigma remains. The HIV/AIDS outbreak is comparatively under control. As of 2021, they were greenlighting like tests on like a cure, quote quote. We got PrEP now. People who have HIV can live like actually really like long lives now.
Mm-hmm.
But the FDA's lifetime ban on gay and bisexual men donating blood, or any man who sleeps with a man donating blood, has persisted up until 2015.
Wow. Oof.
So in 1988, an AIDS activist group, ACT UP, were having a protest at the FDA building. And one person in particular, David Wojnarowicz, he had this denim jacket that is kind of like the fucking image of fighting for queer rights and everything. And this quote has been lifted for a lot of things, especially lately. Wojnarowicz, he died actually in about, I think it was 1993. 1992. Okay. But basically, he's wearing a denim jacket, and there's these white words emblazoned over the pink triangle. And the words are, "If I die of AIDS, forget burial, just drop my body on the steps of the FDA." And it's one of those things that people echo across, well, a whole lot of everything now. People, lifted it for school shootings, COVID-19, transphobia, but it's one of those things. Back then, it was part of the die-ins that they would do because they weren't treating shit, and they're just kind of not doing their due diligence.
Damn. But he didn't die of AIDS, right? He just passed away.
He did die of AIDS.
He did die of AIDS?
Yeah.
Oh my god.
I believe he had AIDS when he wore this jacket.
Well, yeah. I mean, I just wasn't sure if oh.
He was
Yeah.
37 when he died.
Oh my god. Oh. So did they? Did they bring his body to the FDA? Or did they invite the FDA to his funeral?
I did read something unrelated before where they dumped ashes on the thing, but I don't know if they were his
okay.
ashes.
He was an artist.
Aww.
I'm reading about his biography.
Is there pictures of his art anywhere?
Oh, yeah.
Yay. You know I love art.
Sure did. I don't know how I said that, and it was extremely strange.
I like these pieces.
His partner also died from AIDS.
Aww.
Peter Hujar?
I like this one that's a bull over like all the different bills.
Yeah.
Yeah. It's like it looks like it's just a marker drawn bull sticking its tongue out over top of different dollar bills stacked.
That's a very good quote from the end of the article.
If silence equals death, he taught us, then art, language equals life.
That's good. That's good stuff.
See why I cry again.
Mm-hmm. It's called Dollar Bill. 1984. Marker on paper.
I cry. I'm not gonna cry.
It's okay.
All this shit always makes me fucking cry. I didn't know this guy's name before, but like it's the quote. I've always seen photos of him in his denim jacket, and it's just like one of those things that sticks with you. You know?
Yeah.
I'm not gonna cry. Okay, I'm not. Shut up.
I know. I know.
I'm not gonna cry.
I know. I know. It's okay. Yeah. It just is so unfair.
Oh, I guess he wrote or had a lot of books written about him.
Oh.
He had some films directed by him too.
Yeah, dude was I'd say very interessante.
I'm glad we learned his name today.
Your face is glad to have learned his name.
Okay, I've got to stop. I'm just reading about him. Okay, anyway. Yeah, so it wasn't until 2015 that the FDA changed that lifetime ban, and they only changed it to a year. They said that instead of being deferred indefinitely, they would need to still be deferred for 12 months since the last sexual contact with another man. They said, quote, "We've taken great care to ensure this policy revision is backed by sound science and continues to protect our blood supply." That was a quote from Stephen Ostroff, the FDA acting commissioner at that time. So, responding to that guy, a person named Kelsey Louis, CEO for Gay Men's Health Crisis, said, quote, "The United States government has to stop reacting to HIV like it is the early 1980s. It's time for the FDA to implement a policy that's truly based on science, not blanket bans on certain groups of people." And then the FDA's, in-house doctor that they got to talk for them insisted that no, this isn't discrimination, it's science. Once again.
Oh, the time when they used to touch people's heads and say, "You have a lump here, therefore you're an inferior being." That was science.
Yeah, or the time
Yeah.
that they measured people's noses to determine what they were. And I'm like, there's a fucking person. That's what. Let's see. You have all the components that I do.
So, when COVID-19 got so bad that the U.S. started suffering a blood shortage, the policy was changed again to shorten the celibacy period down to 3 months from the last sexual encounter with another man. Not to totally go away, because the FDA, that they say that would be unreasonable. They still have to have a celibacy period according to the FDA. So, according to the FDA, even female donors who have been sexually active with men who have sex with men must adhere to the deferral period and be celibate for 3 months after having sex with that man, further reinforcing the stigma and inhibiting the blood supply during a blood shortage. And as somebody who works in critical care and routinely has to deal with people getting blood, like, Let me tell you, it's difficult when people need blood and there's no blood, and doctors have to decide who needs blood the most.
Oh no.
And other people's grandmas just don't get to have any blood.
Oh my God.
Them's the breaks, Grandma.
These policies affect queer people because they can't donate, and it's discrimination, and it sucks, and it hurts, and it's painful. But maybe if straight people thought about the fact that their grandparents or wife or whatever go to the hospital, and these policies are then going to affect their loved ones because there's not enough blood to give to their loved ones, because we don't have any blood, because the FDA cares more about discrimination from the 1980s than having blood to give to people.
Come on, Remy. We all know what they would say.
It's gay to have blood.
That they care more about the discrimination.
Yeah, they don't want queer blood in their grandparents or in themselves.
Do you know?
And I'm like,
Do you know what?
mhm.
Do you know what? There's like 95% of them would argue that it was science.
Mhm.
And 5% of them would just look you in the eyeballs and just legitimately tell you that they don't want gay blood.
Yeah.
Because I've heard people say and ask, what kind of person did the blood come from? Was it white people?
Yep. Exactly.
And you literally just go, yeah. And you just give it to them because the blood is blood.
Blood is blood. It doesn't matter
It doesn't matter.
what's above it. The blood is what's inside it. Okay? So shut the fuck up and take the fucking blood.
Yeah.
Ugh.
Yeah.
At that
So-
point, I'd be like, oh, you know what? It's not. So, guess you're out of luck. But that's why I'm not a doctor.
It makes you die a little bit when somebody won't get a blood transfusion because they can't guarantee what kind of person the blood came from. It's always old people usually for those ones, because like even when we've had literal Nazis in our unit, like they still just take the blood. They don't ask about it. They just take it because they
Mhm.
don't want to die.
Mm-hmm.
But there's some old people that just really want to hold out on this asinine opinion that it really matters.
I mean, it's insane how people have attributed so much bullshit to blood. Like it it doesn't matter.
We've been in a blood shortage for like 2 years now, and they still won't let gay people donate blood unless they agree to just not have sex.
Jeez. Like even if they still wanted to restrict it, if you are monogamous and you have one partner, like let them donate. I mean, you should allow everyone to donate, but it just doesn't make any sense to me. it's like they think that because they're gay that they're promiscuous and that they're going to have like tons of sex. And I mean, some maybe, but that's the same with straight people.
Any person has any ability to be any level of promiscuous.
Exactly. Exactly.
Sexuality doesn't matter there unless you're asexual, but there are sex favorable aces too. So I mean,
Yeah. I think that I think that it's homophobic, and it's also just it's slut shaming. Sorry.
It is though.
Yeah.
it just does come down to the fact that they believe that men who sleep with men engage in riskier and more frequent sex, which is untrue. So the Human Rights Campaign outlined that, according to the FDA's guidelines and thinking about this, a man who has oral sex with a man is prohibited from donating blood for 3 months. And previously for life. I just want to remind everyone. Previously forever. And then a year, and now 3 months, only because we're in a blood crisis. But a woman who like, let's just pretend has 100 partners, with no knowledge about their personal histories at all
Mm-hmm.
can still donate blood with no deferment period at all, which there's nothing wrong with either one of those things. You have oral sex with your one person. Have 100 partners if you want to, as long as you're safe about it.
Mm-hmm.
But the problem is the unfair and discriminatory policy in place there that says that the man who has oral sex with the one singular other man is the one that needs to have the deferment period here.
Yeah.
So
It's very clearly discriminatory. And it just doesn't, I just don't believe there's any science that can back that up.
So why do they still enforce a celibacy period on MSM even with the blood shortage? That's the next question that needs to be addressed then. According to the Red Cross website, they thoroughly test all blood before it's given to a donor, no matter who it's coming from. Every single unit of blood goes through testing for HIV, AIDS, and any other STI, and literally anything. They test it for everything. So rejecting much needed blood donations is obviously problematic. I wondered if there was literally anything at all scientific about their weirdly specific 3-month waiting period that doesn't appear to be based on science, but I wondered. So, according to Sarah Bass, or Bass, it's BASS,
Mm-hmm.
an HIV treatment researcher, professor of public health, and director of Temple University's Risk Communication Laboratory, she says, the exclusion has persisted because of the argument that HIV has an incubation period. It's possible that someone recently infected could donate blood, and this would not show up on a screening test right away. She says, but there are a lot of ways that we can prevent that from happening, like doing individual screenings on people with high risk behaviors instead of excluding a whole category of human.
Mm-hmm. That's what I'm saying.
She went on to say the waiting period policy is harmful. It perpetuates a number of stereotypes about MSM and doesn't acknowledge risky behavior of any other people. End quote. Many medical professionals agree that risk behavior and not orientation is a better way to determine who should give blood. Quote, the fact is that it's specifically discriminatory because we know that heterosexual couples also engage in high-risk behavior, and they're not treated the same way as men who have sex with other men, says Cindy Duke, a Nevada-based virologist.
Yep. They're saying all the right things. Put them in charge. Get them in the FDA. Fuck the people that are there now.
No, thank you. I don't want to. That's a risky sexual behavior I'm not willing to risk.
You can't give blood anyway.
Yes, I can.
So ironically, the same stigma used to justify blood donation deferrals contributes to the increased prevalence of HIV in MSM communities because stigma experienced by MSM regarding HIV and sexual health translates into distrust of the healthcare system and less engagement with healthcare professionals regarding sexual health among gay and bisexual men. So furthermore, that's just gonna, well, like Karen said way at the beginning, this just leads to poor sex education and safe sex practices because they're avoiding healthcare professionals in general.
Mm-hmm.
So it just leads to more risky behavior because they don't have the education and safe sex practices built up.
It's just so, it's so unfair.
Yeah.
I'm just hoping that it's better for Gen Z. I'm hoping that they've had it better and that they've learned more than we did, at least.
Well, the internet's a much better resource now. And that's where I see a lot of people getting their information.
Yeah.
It's how I got most of my sex ed.
Yeah.
And like just they have a whole different set of problems to deal with. People are horrible in a whole new way.
Yeah.
So, yeah, there's that. So there's also the issue that people who make these policies are afraid of others contracting HIV through the transfusion. So I wanted to find out what's the possibility of contracting HIV from a blood transfusion. And the answer to that question, according to Jared Kirchner, who is the chief medical officer at the American Academy of HIV Medicine, it's 1 in 1.5 million, which is pretty darn low, is his quote.
Yeah. I mean,
He said the last time a recipient of a blood transfusion contracted HIV was in 2008,
Damn.
according to him.
wow. Like, no one wants to risk HIV being spread, but we have ways of detecting it faster now, and it it's just I just with the number being that low, I mean, if you compare it to all of the things that all of the right-wing people were saying about COVID, and what was it? What were they saying? It was like acceptable losses or something.
Yes.
Yeah. And I don't ever want to say that because I don't feel that way. But I mean, there's gotta be a better way to do this to get people the blood they need. And I'm tired.
It's really frustrating because these days you have about the same risk of getting it from blood as you do of getting all the worst symptoms from like ibuprofen.
Yeah.
Like you listen to all the things that we take and like you hear the fast voice that's like blah 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 blah, ass getting diarrhea, fucking you'll sprout 3 heads, and worst of all, you might die or something. I don't know. I was gonna come up with a better joke. I didn't give myself enough time. Sorry.
Well, I mean, yeah, I mean, think about like all the different ways that all the other sicknesses that you know, with how bad AIDS was, I don't want to go there. So, I'm just going to say I think we should do better, and we should, lift the ban because it's ridiculous. The science points to there not being anything wrong with gay people giving blood, MSM giving blood.
So very frustrating.
Yep. So it is. So they keep using the window period thing that I mentioned earlier as a reason why they are keeping this 3-month celibacy period. So Catherine Barr, an assistant professor at University of Pennsylvania's School of Medicine, says that the waiting period is the quote, the window period is relevant when we are diagnosing individuals for HIV, but is less relevant when we're screening blood donations. The virus hasn't gotten to the point where it's in the systemic circulation. So she says that's why that's not relevant, for one thing. But the FDA continues to use the window period as its argument for just totally abolishing the ban entirely. So part of the rigidness stems from the limit of modern sampling, according to Brian Custer, a director of epidemiology and policy science at Vitalant Research Institute. When a donor's blood undergoes screening, a small dose is taken from the 500 milliliter bag, and that means a small sample could test negative for HIV, but a larger source could be positive, he says. And so they're using that also as a reason why they shouldn't lift the ban, but also that could also work the same for most any kind of disease or virus or anything else that could be in your blood.
Mm.
So in those cases, the sexual history question stands in as a backup screening measure, he says. The FDA policy will remain in place until the risk of removing the survey can be adequately measured. An endeavor he and the agency are about to take on. They plan to launch a 6 to 9 month study. This was their timeline they gave themselves in 2020, which was a lie. They launched that 6 to 9 month quote study in July or August or so of 2020 is what they were planning on doing to investigate the risk of eliminating time deferrals at blood centers nationwide, just altogether, just totally getting rid of it. With help from LGBTQIA plus groups and donor organizations like the Red Cross, they were planning on beta testing a new questionnaire on 2,000 gay or bisexual men. Like, with questions like, how many sexual partners have you had? Do you use protection? Do you take prophylactics? The new pool of information combined with the regular blood tests will help them and the other health experts determine if the decades-old questionnaire that they've been using can be swapped out, because they're literally still using the questionnaire from the 80s.
Mm-hmm.
You know what? They need to assess the risk of my foot up their ass.
How long ago was 1980? Like, oh my god.
I'm so tired of this shit.
Computers were in like baby stage.
Well, it's almost 40 years ago when they developed that questionnaire, because I'm 31. So
Back in the 80s, Tron was a documentary.
I don't know if both of you know or if a majority of the audience will know, but do you know the organization GLAAD?
Yes.
No.
Gay and Lesbian Alliance Against Defamation.
Okay.
So GLAAD is an organization for, open my notes back up, is a nonprofit promoting the rights of LGBTQIA plus folks. So they've spoken out against the FDA's impending study. They've been speaking out against the blood donor ban in general for like a while, but they spoke out against that study and said, quote, "The FDA is placing American lives on the line as they debate stigma, not science," quote. Because this was like at the beginning of like the worst part of the blood crisis. It's still going on, like it's still not great, but that was like a really particularly bad moment when they were like all of the blood drives were closed because it was the beginning of COVID. There were no blood drives.
Therefore, no blood.
There was no blood drives at all. They're like stores of blood, and their donations and stuff dropped from like all the blood to like 90% dropped off.
Oh my God.
It was like an enormous decrease. And so they were just like, "Oh, you gay people, you can donate now, but you still have to be celibate for 3 months." So they still just didn't get an increase in donations.
Yeah, like they're waiting 3 months.
So GLAAD was like, "This is stupid." And then their quote, "The FDA is placing American lives on the line as they debate stigma and not science." Quote, the group's president and CEO, Sarah Kate Ellis, said in a press release, quote, "During the current crisis, the FDA is wasting time and money on a pilot study when all the scientific research and medical authorities plainly state that gay and bi men should not be restricted from donating blood," quote. And then they wrote an open letter signed by 500 medical professionals,
Oh my God.
noting that the agency's reduction of the 12-month ban down to 3 months is a step in the right direction, quote, but still, quote, does not go far enough in reversing the unscientific ban. And also at the same time, they wrote that letter, and then Alexandria Ocasio-Cortez wrote one, and the House Oversight and Reform Committee also wrote a note.
Nice.
Good.
But nothing's happened.
Nope. Strongly worded letters barely ever get anything done.
So, yeah, nothing happened.
Yeah.
Yeah. GLAAD then issued a petition in March of 2020 for the FDA to eliminate its time deferral rule for MSM, and it garnered 25,000 signatures, like pretty quickly. Like within a month, it had 25,000 signatures.
Hot shit.
That's a lot.
Look, people want to donate blood.
I mean,
people want to help.
yeah.
Let them help. Fucking Christ.
And the problem is that for COVID in particular, blood was super important. We had a blood shortage, but it was like somewhere midway through all of the COVID stuff when it was like in like 2021 or whatever, whenever they started doing the convalescent plasma experimentation, you can't donate plasma either if you're an MSM.
Yeah.
You can't do that either.
What the hell?
They won't take the plasma. So they're literally begging for people who had COVID to donate their plasma for the antibodies and stuff.
Yeah.
But if you're gay or bi or any other man that has sex with a man, they turn it away.
What the fuck?
So I read several accounts this afternoon in preparation for talking about this. I was reading several different accounts. I read one by a gay physician who tried to donate his plasma and they told him no. And I was reading one by a drag queen, and she was like, "I've been a value to my community for 25 years. I do drag queen story time. I work in the food bank and stuff like this." And she's like, "But they won't take my plasma." Like, she has a long-term partner, and they wouldn't let her donate her plasma, even though she's in a monogamous relationship. Like,
What the hell? Like, I just don't understand. Like, are other countries like this?
no, that was literally the next sentence in my notes. Literally the next sentence in my notes said, Other countries have eliminated similar bans in the last few years, including Mexico, Brazil, Argentina, Italy, Russia,
What?
Do we want to be behind Russia?
South Africa, Spain, and Hungary. We're behind Russia.
Guys, Russia kills gay people. Oh my god. But they'll take their. Oh my god. America, wake up.
Maybe if we put it in the media like really loudly that America is losing to Russia, and we put it as like a race or something to donate gay blood. Like,
Look, do we really want to be behind Russia? Like, do we really want to be asking other countries for their blood? And one of the countries we have to go to is Russia? Come on.
Like, bro.
and those aren't even all the countries. Those were just some of the countries that the GLAD people listed out as being ones that they felt would particularly rile up Americans who weren't in favor of ending the deference period.
Right. Because all of the right-wing people think that Mexico is a third world country, and
Yeah, they picked countries that were made up of Latina people and other like non-English speaking people and Russia.
yeah, which
And they were like, look at these countries that you don't like, right-wing people.
yeah,
They
look.
also let gay people donate their blood. Why aren't you, America?
Why don't you? Just take the blood. It's not rainbow colored, we swear.
Yeah. Because like I think Canada and Great Britain I think just ended theirs. Like so it's like other countries have been ending theirs too.
Yeah, I mean, it's time. It's time. Like, it's time.
Yeah, 2019 was when the ban was lifted in Canada. I just Googled it to make sure I was not lying.
Yeah, and you know what happened after 2019? They probably had a whole lot of blood. Maybe not. They probably had a shortage, but still, they could get more blood.
They said in 2019 they had a 3-month deferral period, but they ended it in 2022, so it's done now.
Good. I'm so tired. I'm so tired of this. Like, just it just doesn't make sense to me. See a need, fill a need.
And then in the UK last year they have no deferral period as long as they're monogamous and practice safe sex.
Right. And like, that's a step in the right direction too. I just think that,
That's a better step in
that's
the right
a better
direction.
step in the right direction. Like, I agree with, I think it was Sarah Bass or Bass that was like, risky behavior is a better determination of like accepting blood versus sexuality.
Yeah, the article I was reading about the doctor that they turned away was all about how they shouldn't be determining these things based on sexual orientation or reported gender, because that's like the next points I'm going to be making.
Oh boy.
Is about it doesn't actually matter. It doesn't actually matter what sexuality, what sex you were born. It doesn't matter what parts you have. What matters is what you identify with on the form, actually.
Oh?
Which is stupid. Which is really stupid, actually.
So, wait.
So, let me, hold on. First of all, over and over and over and over and over again, in these interviews and all the stuff that I was reading for medical professionals, talking about this questionnaire, they were saying some variation of, the only thing that this does when asking people about their sexuality is encourage people to lie.
Yeah.
Yeah,
Yeah.
It said over and over again some variation of, when you are asking people about their sexuality, all you're doing is encouraging them to lie to you so that they can give blood and save people's lives.
Yeah, help their community.
And do the things that they need to do and help their community. Because especially, I was reading an article about the Pulse nightclub shooting and how the Red Cross had to turn away like so many queer people who were trying to help their community.
Right. Like, imagine just being told that you can't help. Like, you've been discriminated against in every possible way, and every time you try to help your community, your country, your family, your friends, like, they're just gonna say no. Like, we don't even want your blood. Like, that is what pisses me off the most.
One person said that when he got turned away in the line to donate blood, it made him feel like not just discrimination, but like they were telling him, you're not good enough. You are inferior to the other people in line.
Yeah. And that's so damaging.
Yeah. So it's awful. So the doctor said they're just going to lie to you because you're asking people to reveal their sexuality when they maybe don't feel safe or aren't ready to do that or don't want to do that because they want to help their community or because they think the policy is stupid, because it is.
It is.
And so a quote from that article that super sums up why this is so ridiculous was by not even a medical professional. It just said, a gay man from Florida.
Oh my God. Good.
His name is James Harkup. His quote says, "Here's the thing. It never made any sense to me as to how they legitimately policed that anyway. How do they know if a gay man is gay? How do they know for a fact if whether or not potential donors have had intercourse with members of the same sex, and how recently? How do they know that the supposed straight male donors have never had sex with another man before? How do they know if they're not bisexual? And it's also outrageous to assume that gay men engage in more risky sexual behavior than straight men." End quote.
Exactly.
Because if a gay man looks you in the eye as he turns in his questionnaire and says, "I'm a straight man," like, what are you gonna do? Are you just gonna be like, "No, you're not"?
Yeah, like
Like,
you're gonna be like,
he could look like the gayest person you've ever seen, and what are you gonna do if he hands in the form that says he's not gay?
oh my God. Oh my God. Drag queen blood drive. Drag queen blood drive. Oh my God.
Well, see, here it is. So here's the next point I was going to make. The conversation about homophobia in blood donation always focuses around gay and bisexual men, because that's who it's affecting. But nobody, like, I literally never hear anybody ask about other queer people. So I looked on the Red Cross's website to see what their policies were on, like, lesbian and transgender people, intersex people, non-binary people, because they do have guidelines for those groups, but I don't ever hear about them. So I looked. So starting with transgender people, because that's the closest thing that applies to drag queens here in this instance. The Red Cross says, quote, "The FDA revised guidance says, in the context of the donor history questionnaire, FDA recommends that male or female gender be taken to be self-identified and self-reported. This change allows blood donors to register with the gender in which they identify. The Red Cross will no longer ask donors to answer both male and female questions when attempting to donate. There is no deferral associated with being transgender, and eligibility will be based upon the criteria associated with the gender the donor has reported." Furthermore, down into the facts section, at the bottom of that page, because I looked in the rest of the facts section. I dug further because that's just very cut and dry. But further down, if you look even further, somebody specifically said, "I am a trans man and I have been eligible to donate because my assigned sex at birth was female. However, I have had sex with another man. Can I donate?" So this person on the form will identify as a man because they are a trans man. So the Red Cross says, individuals who identify as a male and who have had sex with another man are subject to the 3-month deferral period.
What the hell?
So what that says to me is,
It's not about your bits.
it can't follow their own policy, because their own policy, what it was supposed to be about, was about people who were assigned male at birth, who have sex with other people who were assigned male at birth, was supposed to be what the policy was about. That was everything that they have said is that, well, science says that that the male people who have sex with other male people are dangerous, and that sex is dangerous, and we're scared of it, is what they said. And that's not the thing. The thing is that literally, if you just write male on your form, they will still make you defer. Even if you, even if you aren't assigned male at birth, they'll still make you defer. So that's not even, it doesn't even make sense. It stops making even a little sense. So for trans women, for trans women who would be assigned male at birth, individuals who identify as female and have sex with a man may be eligible to donate blood without deferral periods.
What?
So confusing.
So a trans woman goes to the Red Cross and writes down female on her form, and she is not subject to the deferral period because she identifies as a female, according to their transgender guidelines. Because they only go based off of the gender that you are reporting on the form and not your gender assigned at birth.
So everyone just needs to go and say they're a woman to donate blood.
Yeah.
Wow.
Everybody dress in drag
Mm.
and go write female on your form.
Mm-hmm. You don't even have to dress in drag. I'm going to tell Josh the next time he goes, put female on your form. See what happens.
So the Red Cross is supposed to verbally confirm with you what your gender is. They're supposed to look at your form and look at you and then say, so you wrote down here female, is that correct? And so I was reading an article that said that this can be like sort of dangerous feeling to transgender people who maybe don't like visibly pass as well as others. It can feel dangerous and like not safe for them, and they might not want to have to verbally confirm.
Right.
Because I understand that because I don't pass particularly well.
I mean, it's awkward.
It's awkward. It's super awkward. And then anybody who looks at you and goes, "Really? You wrote down man here, is that correct?"
And you're like, yep.
The urge to immediately go, "No, that must have been a mistake." It's really strong.
Wow.
It's it's really strong to just back right out of it, or to just write down your gender assigned at birth, because you know that they're going to question you anyway, and you know that they're going to get it wrong, and you know that you're going to be misgendered, and you know it's going to be horrible. So you just write down your gender assigned at birth, and you just, so you don't have to deal with it. Like, it's a thing that transgender people have to deal with
all the time.
Yeah.
It's not, if you're not a transgender person that like particularly passes, I think it's probably worse than other ones who like manage.
Mm-hmm.
But probably I am not one of them, so I don't know. But probably they probably feel it just as bad as I do.
Well, yeah. I mean, it's just awkward and unfair.
It is awkward and unfair.
I cry a lot about it.
Oh no. I'm sorry.
But yeah, so if a drag queen wanted to go in there in full drag getup and donate blood, she literally just has to write female down and identify as female for that very moment.
Wow.
And then when they go, okay, so I see you wrote female on your form, is that correct? She just has to go, yes.
Yeah, bitch.
Except she says it, yes, ma'am, or yes, sir, or honey, what do you think?
Are we going for a Southern Belle thing?
I don't know. I feel
Obviously.
like a lot of drag queens do the Southern Belle.
I don't think I've ever known one that did.
What?
None of the ones I have personally known do that.
Wow.
But you obviously would if you were.
We've got one step closer to what your diva character is all about.
All right, so I know my character. Oh my god.
And so as long as you have the confidence to do that, nobody can make you do the deferral period. And they are going to test the blood for HIV/AIDS anyway, is why it doesn't matter.
Yeah.
According to an enormous amount of medical professionals, it doesn't matter because they will test every single bit of blood that they get anyway.
Because they have to. They have to. It doesn't.
The Red Cross is fully aware that a lot of people will lie on their forms. And not just queer people, drug users, sex workers, They're fully aware that those groups of people also are likely to lie on their forms because those things are also illegal. So they're very likely to not put those things down honestly on their forms when they want to donate blood.
Mhm.
So they test all the blood.
You know,
Yeah, they have to test it.
I hope they never test my blood. It doesn't do well in a testing setting.
Oh, does it combust?
Yes, it gets really nervous. They don't give it any mints. It always breaks the pencils. Bro. Also, it's stupid.
Your blood is stupid.
It's all that metal you're eating.
Look, you can't help it if it tastes good.
So, for intersex people, that was the next group that I looked at. Intersex people have an enormous amount of their own challenges to face in healthcare settings, like in general. But depending on how exactly they're intersex, because there's like a bunch of different ways you can be intersex, they might be more susceptible to HIV/AIDS than other intersex people, some groups of them. But the Red Cross just says underneath the intersex donors section, it says, quote, male or female gender be taken to be self-identified and self-reported. The FDA requires the Red Cross to have donors select either male or female. Individuals do not need to tell staff that they are intersex, end quote. They just want you to pick one.
Hate that shit. Stop telling me to pick.
Now, so like intersex people are neither of those things.
Yeah.
Intersex people are not male or female.
Mm-hmm.
That's why they're called intersex. They have their own unique health challenges. Frankly, blood donation should probably have a third category specifically for them because they have their own unique things.
But they're gonna test the blood anyway.
So they just shouldn't have to pick male or female because they have their own stuff going on. And
Yeah.
it's stupid that they have to pick. And I just wanted to mention that it's stupid, and that's just a whole separate issue from the one we're talking about, but it also needs to be addressed.
It does.
Yeah. Let's just remove gender from the scenario entirely. Like, just remove it from the questionnaire. It doesn't matter.
Why does my blood have a sex?
There's a way a lot of people that don't believe that intersex people exist,
What?
or don't understand what it is, or don't think that they're as prevalent as they are. And intersex people make up 2% of the population, which is as common as redheads. So if 2% of the population of the United States is intersex, which is as much as being redheaded or having Down syndrome, then it just needs to stop being lumped into male or female and just being looked at as its own thing.
Mm-hmm.
And being addressed as its own thing with its own health issues.
Yeah.
Okay. So, non-binary, gender fluid, agender, and other gender non-conforming people have their own headline.
Oh, sweet, that's me. How bad am I at?
The section says, quote, the Red Cross values all potential blood donors, which is the only section that says that.
Wow.
Huh.
I put it in there. I kept that part of the quote because I thought it was funny. That was literally the only section that said that. There was a section for men who have sex with men, lesbians, non-binary people with a whole bunch of different types of non-binary people, intersex people, and asexual people. And this is the only one that says, we value all types of blood donors.
Wow.
They do not! They show that they do not!
Yeah.
The Red Cross values all potential blood donors and understands that selecting either male or female may not align with how some individuals identify. The FDA recommends that male or female gender be taken to be self-identified and self-reported. The FDA requires the Red Cross to have donors select either male or female. So, pick one.
What if I pick both?
You just check mark both of them and hand it to the person.
I've done that before. Quite a few times, actually. Sometimes you just get angry.
So, like with transgender people, this totally ignores their own policy about assigned male at birth people having sex with assigned male at birth people. Because, I mean, M could just go donate blood and check female
Mm-hmm.
and then just donate blood if they want to, no matter what their assigned gender at birth is. So, just like Josh could go check female, or Cody could go check female.
Exactly.
Or a drag queen could go check female.
Yeah.
So, like, anybody could, just anybody is the point.
Yeah.
And then this has nothing to do with the conversation, but I just thought it was stupid. It said under asexual people, it said people who do not have sex can donate blood.
Wow, who'd have thought?
It was stupid because as an asexual, I was like, wow, Red Cross, just demonstrating that you don't know what asexual means. Because there's like 15 different kinds of asexual, and not all of us don't have sex.
Mm-hmm. Mm-hmm.
Only some of us rigidly don't have sex.
Yep.
It's a sliding scale between absolutely is repulsed by it and is favorable to it, depending on the partner. So there's actually a lot of us who will engage in some sort of sexual behavior, even if it's like only oral sex, and you can still catch HIV/AIDS through oral sex.
Exactly.
Fuck. Sorry.
So one of the various, I read through like 40 websites this afternoon when I got home from my grandma's house, just like reading through interviews and stuff. So one of these websites was like, once said the Red Cross just demonstrates that they have no understanding of the queer community.
Yes.
And I was like, yeah, because the FDA doesn't either, because they make the policies. But then the Red Cross's little asides when they're not quoting the FDA, because that wasn't a quote from the FDA. That was the Red Cross that said the thing about the asexual people.
Aww.
The Red Cross writes frequently little asides away from the FDA quotations where they're trying to like say sorry for the stuff that they're having to do because of the FDA. And probably half the time they're just as like not knowledgeable about what they're writing about.
Yeah.
Like where they write things like, sorry you have to pick one, but do it anyway. And then they'll write 2 paragraphs about how it's cool that you have to, because whatever. Or like the thing about the asexual people where it just says asexual people don't have sex, so it's fine. And it's
There
like,
you go.
Red Cross, you don't understand what you're talking about. You don't have any understanding, and you should educate yourself as like a health organization.
Yep. And they're like,
It's a holdover from the 80s, before we had the nuances of gender identities and things like that, when people thought it was just gay men
mm-hmm.
sleeping with other gay men who got AIDS. And so it's just a holdover policy from then.
Exactly.
Just circling back around to the very beginning when one of you said that.
Yeah.
So lifting the ban entirely, if we manage to ever do that. The UCLA Williams Institute studied what would happen if we lifted the ban entirely, and likely they determined it would contribute some 360,000 men donating, upwards of 615,300 pints of blood.
Wow.
That would lead to an estimated 2 to 4% increase in overall blood donation, and that would be like yearly.
Well, hot diggity shit.
It's almost like they should get on this.
Yeah. Without archaic restrictions in place, we could save millions of additional lives every year.
Yeah. I have hope.
Yeah, hopefully that can happen. So what can we do to sum it all up now that we're here at the end of my notes? What can we do next? The current 3-month deferral period was supposed to be temporary. That was only supposed to be during the crisis situation of the blood shortage, and its end date is supposed to depend on the country's pandemic response, which isn't great. and the FDA says that the 3-month deferral period will end and it'll just go back to a year, when we're not in a blood shortage anymore.
Well, it's going to be hard if we're always in a blood shortage.
Yeah, if we're always in a blood shortage, which we've been in for a bit, and if our pandemic response continues to be abysmal, then it's going to keep being bad. Hopefully we'll keep being in the 3-month deferral period for a while, because at least it's better than a year, which sucks to say. The FDA began to express their willingness to adapt the restrictions to better reflect modern science in the near future. That's when they said they were going to do their 9-month study back in 2020, and then it's still not done.
Damn it.
So it's a good time to be like pushing.
Mm-hmm.
In my reading, pushing works. So activism and petitions and things work. I was reading about like the ACT UP protests and things like that, and I was reading some quotes from Dr. Fauci about how he was so disrupted by protesters when these policies were first put in place during the 80s, because he was part of that, actually. And he said that at one point there were so many protesters that he finally just invited some of them to come up and talk to him.
Ooh.
And he said, I made a deal with them that if they could tell me what their concerns were and they were valid, that I would work with them to change the policy. Or if they weren't valid, I would explain to them why we needed to keep it this way. And they were more right than they were wrong, is what he said.
Uh-huh.
Which just proves to me why I like Dr. Fauci.
Yeah.
The activism can work. Obviously, the ban never did get lifted, but Dr. Fauci is nice and good and he tries, but our administration hasn't been great since the 80s. So,
Yeah.
I mean, there's only so much a single ban can do.
Yeah. There's a lot that goes on, and I don't know. I just feel like it would be very simple. It would be very simple to just be like, FDA, lighten up. They test the blood anyway.
FDA, Karen told you to lighten up.
Karen says
fucking
lighten up.
told you. You goddamn motherfucking lighten the fuck up!
Should I go to the FDA and say, "Excuse me, where is your manager?"
Yeah, put the name to good use.
Well, Karen,
Mm-hmm.
you can contact the FDA. You can contact the FDA's Center for Biologics Evaluation and Research. It manages the regulation of American blood, plasma, and tissue banks. Because if you are a male who has sex with other men, you can only not donate blood. You can't donate plasma. You also can't donate tissue or corneas or other things like that. So you can contact the FDA center that does all of that stuff. The FDA maintains an online platform for commenting on proposed rules and regulations, and has rules for submitting petitions. And I'll link it on our resource page. And you can contact the FDA's manager all you want from there.
Well,
and so can
maybe
all
I
the
will.
other Karens that listen.
Mm-hmm. Mm-hmm.
As well as doing that, GLAAD is super active in this stuff and have been for a while. They write petitions. They say that it's really important to be active by being just loud.
Mm-hmm.
Tons and tons of medical professionals are lending their voices to this cause and have been for a while. So as GLAAD and artist activists like Jordan Eagles and Stuart Simple have shown, one of the most effective ways to make change is to make noise. So share things on social media, like the open letters that people keep writing, like GLAAD and Representative Alexandria Ocasio-Cortez and the House Oversight and Reform Committee. You can contact the FDA at the links I'm going to post. The FDA promised to revise permanent guidelines to be implemented within 60 days of the emergency measures being lifted. But what those would look like are super uncertain because they haven't committed to anything. Hopefully, the FDA will listen to the scientists and activists and GLAAD and the Human Rights Campaign and the Democratic lawmakers and even the late night TV hosts that are pushing for change. So, barring donors from their sexuality alone, not only upholds homophobic stigmas, it costs countless lives. The FDA's pandemic policies are what they are, but that does not mean we can't hope for a more equitable future in this regard. We've come like a long way from the 80s,
Mm-hmm.
and we don't need to keep holding on to policies from the 80s that legitimize hatred in the name of non-existent science.
Exactly.
It's like they're just these needless, harmful restrictions on MSM blood donors exemplify just like the insidious reach of homophobia across the whole country. It's just a holdout of this cultural stereotype that they're all just like poking themselves into random glory holes on the regular.
Yeah. They're like, oh, they put their things in buttholes and other holes and holes that are not lady holes.
Yeah, and the FDA has an issue with the thought, but sometimes men who have sex with men are in loving long-term relationships. So
Yeah. So
it is unfair to ask men who have sex with men to refrain from sexual contact with partners just because their partners are men.
Yeah.
Good night, everybody.
Thanks for listening. Make sure to send a lot of messages and petitions to the FDA. Let's get rainbow blood in our veins, okay?
Yeah.
Rainbow party.
Remember. And remember, if I die of AIDS, forget burial. Just drop my body on the steps of the FDA. But thanks everybody for listening. We are very excited to take your questions too, because we want to hear them and we want to answer them, and we are so super qualified to answer questions. So what you can do is you could visit our website, which is whywouldyouskthat.com, and go to that little contact form, throw in a question, or you can email us at whywouldyouskthatpod@gmail.com. So please send us your questions. We don't care how weird it is, how gross it is. Just don't ask any personal questions. That's our one line. Ask your weird questions. That's what we want. So thank you for listening. This is M, Karen, and Remy, and ask us some shit. Thank you. Good night.